come in?
Come in.
Hi, my name is Demacia, hand hygiene, and I'm going to be your nurse today. Can I have your name and date of birth, please?
Giselle Peniagua, 7/27/1999.
Any allergies?
No.
Okay, great. So today what I'm going to be doing, I'm going to insert a Foley catheter, and with this procedure, I'm going to have a small tube, and it's going to go into your urethral opening, and it's going to relieve some pressure off of your bladder, and it's going to help you urinate, and it's also going to make you feel better. So 2 things I need to know. 1, I need to know, are you allergic to any latex or iodine?
No.
Okay, and just to make sure, do you eat strawberries, bananas, kiwis, and shellfish?
Yes.
All right, great. So another thing I would like to know is, have you had any surgeries on your hip or knees that's going to prevent me from placing you in this position required for this procedure?
No.
All right, great. So first thing I'm going to do, I'm going to perform hand hygiene, and I'm going to provide you privacy. I'm going to provide you privacy first, and then I'm going to perform hand hygiene. Okay, so next I'm going to grab some clean gloves. And I'm also going to ensure that your bed is in the working position, in which it is. Okay. So I'm going to put my gloves on, and then I'm going to pull the covers back to access the area that I'm going to be working with. Okay. Okay. All right, so first, with the leg farthest away from me, I'm going to bend it a little bit, and then I'm going to open. And then with this leg, I'm going to bend it, and then I'm going to open. I'm going to open it so that way I can see a clear view of the perineal area. So I see the urethral opening, and you're clean. So now I'm going to get started with my process. Okay. So I'm going to remove my clean gloves. I'm going to do hand hygiene. I'm going to grab my sterile kit. Open. Okay, so first thing I'm going to do, I'm just going to grab my gloves, and I'm going to pinch this. I'm going to pinch this in, and I'm just going to grab this, lift it, and still with my eyes on my sterile field, I'm going to put this on the table. I'm going to open. Start with this hand. And I'm going to cuff this hand over that like that. And I have those on. So I'm going to head back over to my sterile field. And I'm going to grab my blue pad. And with this, shiny side down, I'm going to take border, and then I'm just going to slide this under my patient, and I'm going to drop it. Okay, so next I'm going to get this, and I'm going to move this a little closer. So I'm going to get my pre-filled syringe. Place this in here for later. Okay, so I'm going to get my alcohol swabs, take it out. I have pre-dipped alcohol swabs, and then I'm going to put my lubricant And then I'm gonna get this portion of my catheter, and I'm just gonna slide this off slowly. And drop it. Okay, so I'm gonna dip this into my lubricant. Put a little more. Okay, I'm gonna dip this in my lubricant, so that way when it go into my patient, it won't cause them any discomfort. Okay, so I'm just gonna sit this over for right now. I can just leave that for right now, because the first thing I'm gonna do, so now I got everything set up. I have my lubricant and I have my cotton swabs ready. So now I have everything set up. I'm gonna get my non-dominant hand and I'm gonna grab the labia and I'm going to spread it. Okay, so once it's spread, I'm gonna get a Q-tip farther away from me, and I'm gonna start at the top. I'm going all the way down. Now I'm gonna throw that away. Grab another Q-tip. Closest to me. Start at the top, all the way down. And I'm gonna do the middle. Start at the top, all the way down. Okay, now that I'm done, I'm gonna get my catheter and I'm gonna insert it in. Okay, so I'm just gonna go in slowly. Okay, let me know if you feel any discomfort. So I'm gonna go in. I'm gonna go in about 3 inches, 3.5, 4. Okay, so I see urine, so I'm gonna go another 1.5 inches. Okay, so now that I'm in with my contaminated hand, I'm gonna stabilize it. Okay. Now that I stabilize it, I'm gonna get my sterile hand and I'm gonna inflate the balloon slowly. Okay. So now that I inflate the balloon, I take the thing off. So now I'm gonna pull to see if I feel a little resistance, and I do feel some resistance. So I'm just gonna leave that there, and now I'm have to move on to securing my device. Okay. So I'm gonna take this out, place this here. Okay. So with this, I'm going to keep my coil in the catheter. I'm gonna keep my coil because it's gonna hang on inside the bed. So I'm gonna keep my coil. I'm gonna place this on the bed. Okay. So I'm gonna get my secure device. I'm still stabilizing it. So I'm gonna make sure my device is connected in the upper inner thigh. Okay, there you go. So it's gonna be in the upper inner thigh. Place it in. I'm gonna snap it like that. So this is gonna be on your upper inner thigh. I'm just gonna place it right there on your upper inner thigh. Okay, so I'm gonna place a coil. And that will just be right there. I'm gonna place the coil. And I'm gonna attach it to the bed. And then I'm gonna put it, can you come on this side? I'm gonna put it on the bed, not on the side rail, but on side of the bed, not the side rail. And I'm just gonna make sure the urine is able to flow down so it won't cause any backflow. Okay, so it's gonna sit like that. And it's, once I have that set up, then I'm pretty much done with the procedure. So it's not gonna stay, so I'm just gonna put it right here. And then I'm gonna clean up after myself. I'm gonna remove all this stuff from my patient. Now all of this is going in the trash. Okay. Okay, so do you feel any pain or discomfort?
No.
So everything's okay?
Yes.
Okay, so now that I have everything in pack, I'm gonna put your legs back down and I'm gonna cover you back up. Okay. Okay, I'm gonna cover you back up. Okay, and I'm gonna remove my gloves. I'm gonna perform hand hygiene. Okay, so now that I have that in place, here's your call bell. I'm gonna put you back in your lowest position, and if you need anything, please let me know. If you feel any type of discomfort or any pain, let me know as soon as possible, so that way I can fix that for you or figure out what's going on. So now that I'm done with my patient, I'm going to document my urine characteristics, how much, 20 milliliters of urine, it's yellow, and I'm also going to document what my patient says about the procedure, her pain, her comfort level and everything. And now that I'm done, I'm going to place my patient back in the lowest position, and the call bell is in place, so if you need anything, just let me know and I'll be here. Okay. Hand hygiene.